നമസ്കാരം. മൈൻഡ് വാച്ചിൻ്റെ ഇന്നത്തെ എപ്പിസോഡിലേക്ക് എല്ലാ പ്രേക്ഷകർക്കും സ്വാഗതം. നമ്മുടെ ഇന്നത്തെ എപ്പിസോഡ് ഒരു സ്പെഷ്യൽ എപ്പിസോഡാണ്. അതിന് കാരണം നമ്മളോടൊപ്പമുള്ള ഗസ്റ്റ് തന്നെയാണ്. നമ്മളോടൊപ്പം പ്രശസ്ത ക്ലിനിക്കൽ സൈക്കോളജിസ്റ്റ് ഡോക്ടർ ഏമിയാണുള്ളത്. ഇന്ന് ഡോക്ടർ നമ്മളോട് സംസാരിക്കാൻ പോകുന്നത് ഡ്രഗ് അഡിക്ഷനെ കുറിച്ചാണ്. നമുക്ക് ചർച്ചയിലേക്ക് കിടക്കാം. വെൽക്കം ടു ദി ഷോ, ഡോക്ടർ ഏമി.
Thank you.
Okay, first of all, to be very specific, drug addiction and drug abuse.
Okay.
Are they both the same?
They're not the same. It's really a matter of severity.
Yeah.
Somebody who has addiction usually has a physical dependence on the substance, like such as alcohol or drugs.
Yeah.
And somebody with abuse does not. So somebody with physical dependence will experience withdrawal symptoms when they stop using, and somebody with abuse does not. Here's an example. Imagine that you wake up in the morning and you have a headache,
Yeah.
you feel nauseous,
Yeah.
your hands are shaking
Okay.
because you were drinking the night before heavily. All you're thinking about is how you can stop your hands from shaking.
Okay, and you need to take another dose.
And you need to get more.
Okay.
So your whole day is organized around that. For example, you think about going to the tea shop where the lady you know will put a little rum in your drink so your hands will stop shaking.
Okay.
You go to work and all day long you're thinking about how
Having
you're going to get
something.
your next drink.
Okay.
So after work you get paid and then you go to the Bevco shop, wait in line, spend most of the money that you just made to pay for the alcohol, and you're not thinking at all about your wife who might need money for food
Yeah.
and rent. That's the life of an addict.
Okay.
Whereas somebody who is just abusing alcohol or drugs may go to the bar 2 or 3 times a week.
Okay, it's not like I need it to.
Function.
Yeah,
Correct.
it's not like that.
It's not like that.
Okay. And then nowadays we can see what we see in our society is that drug addiction, it has most often it's seen in college students and in the adolescence age
Yes.
rather than the senior people, obviously. Why is it so?
Well, I think you're talking about 2 very different stages of development.
Not actually like that. College students, they are more addicted to drugs
Yes.
more than the senior people.
Yes.
Why is it so?
Okay. Because when students go off to college, it is their first taste of freedom.
Okay.
And they see their peers using drugs or alcohol, and that's very enticing.
Okay.
They are not under the scrutiny of their family. So that, in addition to stress, poor coping skills, and not being in front of their family makes using alcohol more habitual. In other words, they'll do it more often because they can.
Like, do you mean like to show off in front of friends, or if like parents are not there in college, obviously, so they'll get more freedom in college?
Yes, and peer pressure too, because a lot of people start drinking then.
Okay, but last day I saw a newspaper clipping like small kids, and they had a small shop near their school. Near their school they had a small shop.
Yes.
And in that shop they were supplying drugs, like in small contents inside pens, inside matchbox, like that they were selling drugs. And these kids used to go there and get these drugs and use it in the class. When they were sitting in the class, they used to have these drugs.
Here in India.
Yeah, I saw a newspaper clipping like that. So society, to make money or for something of that sort, do they use these small kids and make them to drugs?
Well, if you're talking about the people that are selling the drugs, I'm
Yeah.
sure that they want to sell
What
it
they
to
need is
whoever.
money.
Yes.
And they don't think about the society or the future generation. They don't think about anything.
Right.
So what can we do about that?
Well, addiction is a very treatable disease.
Okay.
So if we're talking about the treatment of it,
It's not about the treatment, about the society.
about the society.
Yeah, I know you have
What-
been doing research. Okay, so more than the people like I need drug, more than that sort of a thought, certain people, they bring children to drugs. They like force them to use drugs.
You're talking about their family or other
Not
people
family,
outside
other
the family?
people outside. Once they're out of their house, then they are with external people.
Yes.
They are coming in contact with external people.
Yes.
And these people, they force them to use drugs.
I didn't realize that they forced them.
Yeah,
there.
they're like you use it once, then you will know what like happiness is. You know what the feeling is after using drugs. So
to get them hooked.
Yeah.
I see.
Yeah.
So then that they will keep coming back and wanting the drugs and paying for the drugs.
Yeah, and what they get is money. Okay, so why is the society so? Why is the society doing so?
Why does the problem of drug abuse
so
exist?
they should understand that it's their future generation. It's their future generation, small kids, the next generation, the small kids are the next generation.
Yes.
And if they give them drugs and destroy them from the very grassroots level,
Yes.
It's really like, what to say, it's a very big thing, you should not do it.
Yes, it's tragic, really.
Yeah, so what I'm asking is there any compulsion or any cause for this adolescence age using drugs? Is there any specific cause or any compulsion?
Well, let's say this. In adolescence, kids are in turmoil. Their bodies are changing, their hormones are changing, they are worried about their peers, and you add to that the fact that there might be family history of substance abuse, depression, impulsivity, ADHD, all that together makes a recipe for addiction.
Doctor, could you please tell me any of your experiences in this?
In the treatment of addiction?
Not only in the treatment of addiction, any cases you have come across in your research life?
My research life. So I've been doing some research here on addiction. And
basically here, main topic over Indians?
Indians, yes. Okay. Here in Kerala.
Okay.
I've visited several addiction centers, or you call them de-addiction centers, and I was allowed to observe how they do treatment here.
Okay.
Most of the treatment here is done on inpatient. In the U.S., there's probably more outpatient.
Outpatients, okay.
Because people can't afford to take off a month at a time to get treatment. Yeah. So that's a big difference here. Also, there's more use of certain medications here that we don't use as much in the U.S., like disulfiram, which is used for alcohol dependence. The biggest difference, I would say, and I think it's very important, is here there's a lot more family support. You will not see that in the U.S. In the U.S., there's patients come in really more alone. They don't have bystanders who come and stay with them like here.
I think what you're saying is in Kerala, family members bring the patient to the doctor.
They bring the patient, they stay at the addiction center
and
with them.
And they stay from first to end? Till he is or she is?
They usually stay, I think, at the detox period, which is the first week or so.
Okay.
But they continually come in and have family sessions. They work with the couple. They have the children come in. It's very important for an addict to feel supported by the family. And I think that is something that I will definitely report back.
But you don't find that in U.S.?
Not so much.
Okay.
What happens, I would say, in the U.S., and I think it has to do with culture, is it's a much more individualistic culture.
Yeah, of course.
And here, I think the family is very important. And I actually was very impressed with the wives here of patients. They have to be very strong. They stick it out with them no matter what. And they have suffered a lot.
To bring them out of this addiction.
Yes, they have suffered, verbal abuse, physical abuse when their spouse is intoxicated.
Even when they're in a treatment?
No, not when they're in treatment. No, of course not. But
they have to face the treatment alone. The patients, they have to face the treatment alone?
In the U.S., is that what you're saying?
No,
or
here.
No, I'm saying that the wife is usually comes for family sessions is there the first period of detoxification, about 5 to 10 days, and very involved in the treatment. And that is, I think, really valuable. And I think that is one of the main reasons why the treatment works well here.
Yeah, don't work that well there.
Our success rate is not so great at times. And I think that I would bring back to the United States saying that I think family support should be a bigger focus in the treatment of addiction. Okay,
about if a person, say let it be a family member or a relative or a friend, if someone like that wants to identify a person who is addicted to drug.
Okay.
Okay.
What would they see?
Yeah, are there any physical or any behavioral signs which these patients show?
First of all, if there are any parents out there watching, I would say, you know your child the best. And what I would say is you should notice if there's any significant behavioral change, especially with adolescents. What you often see is they may have change in their behavior at school. They may start, their grades may start dropping. They may have new kinds of friends that may be using drugs or alcohol. They may become more moody, more secretive. If you see any of these kinds of behaviors, those may be signs that your child is using. And what I would recommend to those parents, the physical signs as well, in terms of, like, for example, marijuana use, or ganja, I think they call it here, is one of the signs is red eyes and an increase in appetite. Those are physical signs. And as far as alcohol goes, I would keep your nose open, because you can usually smell alcohol on people.
Of course.
But I think that what's important is to address the situation with your child, actually open up the conversation, communicate, but not lecture. Be curious with your child. Ask them, have they ever been around drugs or alcohol? What was it like for them? How did they feel about it? Have they ever used? But try not to be angry or punitive. I think
that's what parents obviously do. They just start shouting, this is not what I expected out of you. What have you done? I think they just explode.
The effect of that, though, is that the child will withdraw and even perhaps make the situation worse, because they will not feel understood or cared about if their parents just yell at them. So I am recommending that parents don't lose hope. Try to communicate with your child and then get treatment, because treatment can work.
Do you think these family situations leads children to using drugs?
Sure, especially if...
Have you come across any case specifically?
Absolutely. Okay, so if there is, I think I said, a family history of alcohol or drug use, then the child is at higher risk than a person without a family member who uses drugs. So that's one thing. The other thing is if the child doesn't feel nurtured or supported by their parents, that is also a factor that can lead to the use of drugs or alcohol.
Parents should be, if the children see parents using drugs, or say they don't use drugs in front of children, they use alcohol. What I've seen in our society is, on Saturdays, parents just come together and they use drugs, alcohol. In front of kids. Does this tempt them to taste it?
Here's what I would recommend, and maybe this is more of an American approach, but that can be a teaching moment for the child. If the parent is using alcohol, talk about it with them. Say, okay, you see this is alcohol, this is rum, or this is vodka, and I really hope that you never use it, but I want you to understand that if you use it safely, moderately, you will be okay. But right now, you're too young to even try.
You don't want this now?
No. But if they're curious, let them ask you questions.
Okay,
about
you have
it.
to be friendly with children. That's what.
Friendly but firm. You want them to know that you don't want them to start to use drugs or alcohol, but kids are curious, and when they're adolescents, they tend to feel like they're indestructible and that they will do a lot of high-risk
they feel
behaviors.
like they're top of the world.
That's right. And they're not afraid to try things, and not afraid to try things like drugs and alcohol. So I think parents want to really try to guide them about it, give them information, just mainly that you want them to be able to talk about it with you, because you don't want them to go out and use drugs and alcohol and then it become a huge problem. But I go ahead.
Yeah, and doctor, if we want, what we are talking is about after the use of drugs or after the use of alcohol and those things. At a very young age, what can we do so that they just I know this is not good for me, this is not the thing what I want, and they back off. At a very young age, they should be aware of that. What can we do for that awareness?
Raise awareness, just in the same way that I was suggesting that talk about the dangers of drugs and alcohol to your child. The truth is that the earlier someone starts to use drugs or alcohol, the greater chance they have of becoming an addict. So you really I want to say to parents, really keep your eyes and ears open with your children, because if you see signs of it, it's really important to get treatment right away.
Okay, that's with the family. You should be open, you should talk to your children this is not good for you. That's in the family.
Yes.
What about in schools or colleges?
I think it would be great if, I don't know about the schools here. I'm actually going to be giving a talk to my daughter's school here.
Okay.
But I think that's really important to have schools.
What can they do from their part?
The schools?
Yeah.
Have a program about informing them about the dangers of drugs and alcohol. I think information is very powerful in terms of prevention.
But I think that more than making a child come and sit in front of you and you should not use this, and giving him information all the time, they don't take it like they're given. So what are the other means? How other ways can we? Without giving a lecture this is not good for you, don't do this, don't do this. Without
Right.
saying like that, what are the other options? They should realize from inside that this is not good for me.
I think if they learn about the negative consequences, I think that is also helpful. I told my son when he was an adolescent that when we would have wine sometimes at dinner, I would say this is the most dangerous drug, and the reason is because it's legal and you can get it. And also I've treated patients that are addicted to all kinds of drugs, but I really do believe alcohol is the worst in terms of how it affects your brain, how it affects your body, your liver. My son is an athlete, and so that was really important to him. I connected with that part for him because his body was very important in terms of being an athlete.
Oh, yes.
So he did not want to do anything to harm his body. So I think that made an impression on him.
Doctor, let me ask in general. In US, how is this situation about drug addiction?
Addiction is a big problem in the US. Alcohol probably is number one.
Compared to India, how is it?
I think it's worse in the US. But I do think that in India, from what I've spoken to a number of people, I think the problem with alcohol here is really, especially in Kerala, I think maybe you know that Kerala has the highest rate of alcoholism in all of India.
Course, yes.
And I think that that's really developed in the last 20 years. We've had alcoholism, I think, longer than that in the U.S. We have, I've seen people with all kinds of drug addiction, alcohol addiction, and we have a variety of treatment there as well. As I said before, it's mostly outpatient, but they do have inpatient. They also have long-term residential treatment, meaning somebody can go to treatment for 6 months, 8 months.
Where do these people get these drugs from in US?
Well, there are drug dealers everywhere. I mean, I think if people want drugs, they can find
I've heard
them.
that they can find it from the streets even.
Yes, yes.
Is it so?
It's absolutely so. Drug dealers want to make money, and I live in near New York City, and there's a lot of drugs there, and it's a huge problem. But there's also a lot of treatment options.
In US, what's the smallest age you have seen a person using drugs?
That I've seen, I think I've started as young as, say, 12.
12. But in India or Kerala, it's not.
I would say
I was just going for a comparison about how they would.
There was somebody in one of the de-addiction centers that I visited that was 14. Yeah, and that's the sad thing. The younger, the higher risk they have for continuing and developing a real addiction, and it's much harder to treat later.
Do these small kids feel like, I have to get out of this? Do they feel, I don't need this, I have to get out of this somehow? Do they come like that, or do parents bring them?
Most of the time parents bring them because they don't want to be in treatment. I mean, they think there's nothing wrong with them, they're just having fun. So, it's very hard to deal with adolescents. They are a whole nother sort of kind of population to deal with in terms of addiction treatment.
I'm coming to our last question.
Okay.
About the treatment procedure. Are there any supporting groups these people can approach, like those who are addicted to drugs?
Here in India, you have de-addiction centers. There are about 700 of them here. Most of them are NGOs, and the rest are government-sponsored programs.
Okay.
And I would say that if you have a child who you think
addicted,
might be using, then I would first go to your doctor or your school counselor or your pastor to see if they can refer you to the proper treatment center for an adolescent. If you're an adult and you're struggling with addiction, I would say there are two places, TTK in Chennai, the TTK hospital, and the National Institute of Mental Health and Neuroscience, NIMHANS, up in Bangalore. They really have state-of-the-art addiction treatment. And as far as support groups, here and all over the world, there is Alcoholics Anonymous, which is AA. And it's a sober support group of alcoholics who are in recovery trying to help other alcoholics.
Okay.
So it's a peer group. And they have meetings. And here in Trivandrum, there are meetings as well. You just need to go to Google and Google Alcoholics Anonymous, and you can find the meetings that way.
Okay, ma'am. Anyway, this was a very interesting topic and interesting session, and I'm very glad that I had a chance to talk to you today.
Well, thank you for having me.
Thanks for being with us today.
Thank you.